Anyone who's been watching the news recently will know that there's been a lot of talk in the media about weight loss medications. Recently meaning approximately the middle of summer in 2025. Up until now, there's only really been one medication available for weight loss, and that is Orlistat. Now, Orlistat essentially works to bind fat in your gut and reduces the calories of your food. In practice, it's not particularly effective, and it tends to work by giving you diarrhea until you possibly lose weight or give up. Though, loads of credit to anyone who has had any success using this medication. The main two current medications are Wegovy and Mounjaro, with Mounjaro, or tirzepatide as it's more accurately called, being the more effective of the two according to scientific evidence. In essence, these medications work by reducing the speed at which your gut moves food through, which means that you feel a bit fuller, and also directly suppressing your appetite so you simply feel a little bit less hungry. And research has shown that at the right dose they are incredibly effective at reducing your weight. Now, before I say anything further, it's really important to remember that no medications come without any health and safety risks. Firstly, these are diabetic medications, and any medication which successfully reduces your blood sugars faster than your body can handle is associated with a risk of going blind. This is the reason why most professionals recommend starting the medication gradually rather than going onto a high dose too quickly. And I have to say, I would agree that that's pretty good advice. However, it's certainly human nature to try and increase too quickly, especially as a lot of people report that the medication's not particularly effective until they reach the 7.5 or even 10 milligram dosing, which is the third or fourth step up the ladder, which means actually the third or fourth month on the medication before they start to see any effects. Another known risk is the risk of pancreatitis. Now, pancreatitis is a potentially life-threatening abdominal condition. Early research seems to show that there's about a 0.02% risk of this happening while on the medication, which is about the same as the risk of dying if you drive from Aberdeen to Edinburgh by motorcycle. However, it's really important to remember that these are quite new medications, which means that the risk profile will continuously be refined as more information comes in. And of course, that also means that there may be risks in the longer term which we're not yet aware of. However, one of the risks which we are aware of is that there is a chance of losing a certain amount of muscle mass as well as fat while you take these medications. However, it's also worth balancing this off against the risks of obesity, which are pretty spectacular, and you can look up the evidence there yourself if you want to. And whenever we talk about risks, the thing we always seem to forget is the quality of life component, which is quite an important thing for most people. So, after balancing up the risks, many people make the decision that they would like to try this medication, but how do they go about it? These medications are prescription only, which means the only legal way to obtain them is via a prescriber. By prescriber, traditionally that means a doctor, but now also includes certain specialist trained nurses, paramedics, pharmacists, and a few other suitably trained professionals. The most common way to obtain these medications is through a private prescriber. I'm not going to go into that in too much detail just now because there's plenty of other videos on the internet about how to do that, including a video on my other YouTube channel. And you're probably watching this video because you're hoping to get a prescription on the NHS. Unfortunately, I've got really bad news about that. The NHS have really strict requirements about who this medication can be prescribed for. In addition, not only are there national rules, but there are also local rules as well which we need to follow. For instance, in Devon, there's been a complete blanket ban on all GP prescriptions for these medications. However, I'm in Cornwall, so those particular requirements don't apply to me, or presumably you, as this video is aimed at my patients. Firstly, just a reminder that this is a diabetes medication, and if you have diabetes, different rules apply. The medication will probably automatically be considered at your next diabetic review if it hasn't been already. So, for non-diabetic patients, what are the requirements? 1. You need to have a body mass index of over 40. If you don't know what your body mass index is, there are lots of online calculators which will help you to work it out. If you do know anything about body mass indexes, you might complain that that isn't a perfect measure of obesity. However, don't complain to me, I don't make the rules. 2. You need to have high blood pressure and need to be on treatment for it. 3. you need to have high cholesterol. 4, you need to have heart disease. Or to be more technically accurate, you need to have atherosclerotic disease, which either affects your heart or your cerebrovascular system. And 5, you need to have a diagnosis of obstructive sleep apnea, which has been confirmed by sleep studies. Locally, that's quite difficult due to a quite obstructive set of rules for sleep study referrals. So locally, it probably realistically means that you need to consider a private sleep study assessment if you suspect that this might be a problem. We have already audited all of our patient notes to see if we are aware of any patients who meet these criteria, and we have 0 patients that meet those NHS criteria. Next year, the criteria are going to be loosened again, and at that point we have a small handful of patients who will meet the criteria, but I could still count the number on my fingers without even needing to use my thumbs. And the year after that, the criteria will be loosened slightly further again, but will still be incredibly strict. After that, who knows, we'll have to wait and see. Hopefully the prices of these medications will start coming down, which means the NHS prescribing criteria will also start to relax at that point, hopefully. However, it's really important to remember that this particular medication is also a political hot potato, and most people fall into one of 2 camps. The camp who know that it's really difficult to lose weight and want any help they can get, and the camp who feel that if you're overweight, it's your own fault. And as the NHS is government funded, that means that politics do start to play a part, so who knows what will happen as a consequence of that. It may be that the rules get relaxed more quickly than expected, though on the other hand, it may be that the medication ends up being non-prescribable at all. And as has been the case with several other effective weight loss medications over the last 10 to 20 years, it may be that it actually gets pulled from the market due to safety concerns, which I think would be a real shame. But again, these things happen to perfectly good medications. But unfortunately, what that means is that if you want to try these medications, unfortunately, you will probably have to go through the private pathway. Now, I'm going to pop a link below to a website which has some good information on it. Now, it's not an NHS website, so I can take no responsibility for the quality of the information contained in there, but it's a useful website to have a little look at to get a bit of information. And as with any medication, if you have any queries about your suitability or the medication in general, you should raise it with the person who you expect to prescribe the medication, as they are the best person to answer any questions. But for now, good luck with your weight loss journey, and that's goodbye from me.